guess we're ready to get started. Thank you so much for joining us today for what I'm sure will be an extremely interesting panel. My name is Claire Finkelstein, and I'm the Algernon Biddle Professor of Law and Philosophy here at the Law School, and I'm also the Faculty Director of the Center for Ethics and the Rule of Law. CERL is a nonpartisan interdisciplinary institute dedicated to preserving and promoting ethics and the rule of law in national security, democratic governance, and armed conflict. We hold conferences, produce academic volumes, and briefing papers on a wide range of issues, and we also partner regularly with the military, particularly the Army JAG Corps. So this topic is very important from our perspective, from the perspective of our work. But we're also particularly honored that Susan Sorenson and the Ortner Center wanted to partner with us for this event. I've had an opportunity to work with Susan before. We co-sponsored with the Ortner Center a program on trauma, sexual trauma, and combat trauma. And we were able to have that taped, and it was rebroadcast on WHYY. And we also worked together around the revision of the campus sexual assault rules. I was able to partner with Susan many years ago when I was chairing the Faculty Senate and was able to ask her advice. And she's really been a guiding light on those issues here on campus, as well as in so many contexts for the broader public. The topic of sexual violence and the military is a critical one. Often social changes in the military are a harbinger of changes in the broader society to come. And often the military provides an influential example for social change. On the one hand, there is great integrity in the way officers are trained and the character they are taught to build. On the other hand, the problem of sexual and relationship violence has been a persistent one in the military setting. Pentagon leaders have referred to the problem as a cancer within the ranks. The contrast between the focus on character and integrity and the passivity with regard to sexual violence has been shocking, to say the least. Yet there is an opportunity for change, and I think change is in the air. With encouragement of the Obama administration, for example, Senator Claire McCaskill took on sexual assault in the military and sponsored the Victims Protection Act in 2014, a bill that was approved in the Senate 97-0, though it did not go on to be voted on in the House. But the main purpose of the bill was to do away with the good soldier defense to allegations of sexual assault, a change that is potentially a critical one. She next turned her attention to sexual assault on campuses and dramatically changed the approach to such cases across the country. There, I think she had relatively more success. Penn's own sexual assault protocol was altered significantly as a result of her efforts. So, as I say, I'm delighted to introduce this program. I'm going to turn the microphone over to Susan Sorenson, but let me first introduce her formally. Professor Sorenson is Professor of Social Policy and of Health and Societies at the University of Pennsylvania School of Social Policy and Practice. She is also the Executive Director of the Ortner Center on Violence and Abuse at the University of Pennsylvania. She has unique interdisciplinary background in epidemiology, sociology, and psychology, and currently teaches 3 courses that she developed that are really rather unique, called Foundations of Public Health and Violence in Relationships. She has written more than 150 articles on important and impactful topics and is an extraordinary and rare expert on violence, sexual assault, child abuse, and other critical topics in public health. I now turn the microphone over to Susan Sorenson. Thank you.
Thank you. And I appreciate the warm welcome. I'm Susan Sorenson. I'm the Faculty Director of the Ortner Center on Violence and Abuse. And as we know, violence and abuse is not the purview of any single academic discipline. And as such, the Ortner Center involves 9 of Penn's 12 schools, the students and the faculty from them. And we also welcome community activists and academic colleagues, two of whom you'll hear from today. We're pleased to host this panel of distinguished experts, in part to mark that October is Domestic Violence Awareness Month, and soon our nation will be marking Veterans Day. So the phrase violence against women in the military might bring to mind servicemen committing horrific acts against women in the context of war, or servicemen raping civilian women near the base where they are stationed. Today, however, we're going to focus on the military as a workplace. Now, each branch of the U.S. military has its own reporting and judicial system separate from the system used by civilians such as you and I. So these systems, unique to the military, also have unique strengths and problems. And for example, if a victim is supposed to report an incident to her superior, to her commanding officer, what if that commanding officer is the one who committed the assault? And what if he, in turn, then decides not to forward the complaint to his superiors? These and other issues have been the focus of congressional hearings and actions in recent years, as Professor Finkelstein indicated. Although congressional interest is relatively new, sexual assault is not new, nor is the reality of women serving in the military. Women have served in the U.S. military since the Revolutionary War. And today, about 10% of the veteran population is women. And we'll see even more women vets in the future, because about 17% of those currently who are serving as military personnel are women. And 30% of the service academy students are women. In fact, women are the fastest growing subpopulation of both service members and veterans. Sexual assault and intimate partner violence is not new either. And rates are highest among 18 to 24-year-olds. We were reminded of that when last week the AAU released its 2019 surveys of sexual assault on college campuses. Penn was one such campus. And we learned that more than 1/4 of the Penn undergraduate women report that they experienced unwanted sexual contact as a student during college. This is the same age population that enlists and serves in the U.S. military, a point that our panelists likely will return to. I'd like to turn to the panelists themselves at this time, and each has a long list of accomplishments and awards, and I'll highlight just a few for you, okay? First, Andrew Merrill is a senior behavioral scientist at the RAND Corporation, where he leads gun policy in America and directs the National Collaborative on Gun Violence. He served as a senior science advisor to the National Institute of Occupational Safety and Health, to the Department of Homeland Security, specifically the Center for Risk and Economic Analysis of Terrorist Events, and to their Chemical Facility Anti-Terrorism Standards Program. In addition to his firearm policy work, his recent research includes an evaluation of the Israel police force and multiple assessments of terrorism risk models and deterrence benefits that are attributable to counterterrorism security. In addition, he has authored reports to Congress based on his multiple studies of the prevalence and characteristics of sexual harassment and assault of members of the U.S. military. Melissa Dichter recently left the School of Medicine here at Penn to assume a position as a tenured associate professor in the School of Social Work at Temple University. She is also the associate director and core investigator at the Philadelphia VA, their Center for Health Equity Research and Promotion. And she's a scholar with the Ortner Center. Her research focuses on individuals' experience with and systems responses to intimate partner violence. She's committed to conducting research that will inform practice so as to improve women's lives. Of particular relevance for today's discussion is her focus on identifying and meeting the health and psychosocial needs of women military veterans and of gender and sexual minority populations. Emily Rothman is a professor of community health sciences at the Boston University School of Public Health, where she also has appointments in BU School of Medicine and Pediatrics and Emergency Medicine. She's also a scholar with the Ortner Center. Emily has authored publications ranging from intimate partner violence, sexual assault, human trafficking, firearm violence, and pornography, with a focus on marginalized populations and health inequities. She's consulted by the media frequently, and just to offer one example, she gave a TED-Med talk in Palm Springs on how porn changes the way teens think about sex. It was posted 5 weeks ago, and at least as of last night, had 1.8 million views. Okay. So in May of this year, moving on, the House Committee on Veterans Affairs launched a new bipartisan Women's Veterans Task Force to increase the visibility of the 2 million women veterans living in the United States and to promote inclusivity and equitable access to resources, benefits, and health care for women veterans. They chose Andrea Goldstein to be the lead staff member. Andrea served on active duty in the U.S. Navy from 2009 to 2016 as an intelligence officer and currently serves as a Navy reservist. She's also deputy to the NATO ACT Gender Advisor and a non-resident fellow at the Modern War Institute at West Point. As a military officer, she was responsible for over 100 personnel in dynamic, ambiguous environments, including humanitarian and crisis operations in the Middle East, Africa, and East Asia. While serving as a troop commander in special operations forces, she was instrumental in developing best practices to integrate women into previously all-male teams. Andrea is also a world traveler, having traveled to over 45 countries in 5 continents, not all of them in uniform. Their discussion will be facilitated by Professor Kathleen Brown, who is a historian of gender and race in early America here at the University of Pennsylvania. She also directs the Gender, Sexuality, and Women's Studies program at Penn, and recently was a Guggenheim Fellow. Among her multiple publications is the book Good Wives, Nasty Wenches, and Anxious Patriarchs, Gender, Race, and Power in Colonial Virginia, which won the Dunning Prize of the American Historical Society. Her current project examines issues of freedom and coercion in the transportation of slaves, convicts, and indigenous peoples and the extraction of slave labor. As I turn the microphone over to Kathleen, I would like to do 2 things. One is to let you know that there have been cards that have been handed out to you on which we will collect over time. If you have a question to ask, please jot it down there, hold it up, we will come and get it, and we will ask those towards the end. Does anybody need a card who doesn't have one? Good. A couple of people? Okay, good. Thank you for that. And as I turn the microphone over to her as well, I'd like to thank our collaborators and the event co-sponsors today. Campaign for Community, an initiative of the Provost's Office, the Trustees Council of Penn Women, Penn Law's Public Interest Week, particularly Arlene Finkelstein, the Center for Ethics and the Rule of Law, specifically Claire Finkelstein, and her able staff, and an extra shout out to Elizabeth Allup. I know I'm going to say your name wrong. Okay, but we appreciate Elizabeth's work. Okay. The Alice Paul Center, and Betsy of the Ortner Center, who's passing out the cards right now. So thank you, welcome. I think we're going to have an interesting hour ahead of us.
Thank you, Claire, and thank you, Susan. We'll get right down to it. What we're going to do is, I've got some questions for each of the panelists, and I want to make sure I move through the panel and let everybody get a chance to answer a couple questions, and then we'll see where that takes us. I've got questions to take us through, at least till tomorrow morning. We won't be here that long, though, I promise. But we'll see if other issues don't come up that the panelists want to address among themselves. So I'm going to start with Andrew, if that's okay. And I want to start by addressing this research that Andrew has done, collecting data from members of the military, 150,000 responses to his surveys about their sexual assault and sexual harassment experiences. So obviously a real rich load of data. And my first question is, what have you learned about the relationship between sexual assault and sexual harassment in the military?
Well, so this is a survey that's required by Congress, and when we did it in 2014, it was the first time it had been so huge. Congress had actually wanted everyone in the military to be asked this question. We told them that that would be wasteful of people's time. But it ended up being very big, and because it was so big, we were able to do things that haven't been possible to do before, including producing estimates of sexual assault risk for smaller clusters of service members. So we are able to look at it by command, by installation, by occupation, and we can see where there are high and low risk clusters of service members. And there were quite substantial differences, and some of the differences were surprising. We didn't know, and they didn't know, that ships were the most dangerous places in the military across services. But to the question of sexual harassment and sexual assault, what we found was an incredibly strong correlation between sexual assault risk and sexual harassment risk across all these different kinds of locations. In fact, the correlation was over 0.9. If you know what that means, it means it's practically you're measuring the same thing. Now, some of that is not that interesting. As Susan mentioned, sexual assault and sexual harassment are very strongly associated with age. And the military is diverse in terms of age. There are some places like Fort Hood or Camp Lejeune, places like that, where you've got lots and lots of young people. You would expect there to be lots of, just because of the way sexual assault, sexual harassment is associated with age, you'd expect there to be a lot more sexual harassment in those places. But even when we can control for age, that means we adjust for the fact that there's some differences in age. We adjust for the fact that there's differences in marital status, how many dependents they have, how long, how many months they've spent deployed. We have like 25 very reliable characteristics that we can adjust on. And even when we do that, we see super high correlation between sexual assault and sexual harassment risk for women and for men. And we also see super high correlation between sexual assault risk to men and sexual assault risk to women. In other words, the places or the clusters of service members that are high risk for men are high risk for women as well. There's some common risk factor or etiology of risk across these locations. So that has been, that's interesting and I think useful. And I'll just say one more thing about why I think this is sort of useful. If you're trying to stamp out sexual assault, you're looking for something that's fairly rare. 1% of men, 5% of women, 5 or 6% of women per year. That's not to say it's as rare as it should be, but it's not a super common thing. And it's also it's often very private. People often don't know about it, other than the two people who may have been in the room together. And so it's often not reported. So it's very hard to see sexual assault and find it. Sexual harassment is the opposite. It is often very visible. People are quite aware it's going on. It's much more common. And if you ask women in the military, in 2014, when we asked them how common is sexual harassment, 3/4 of them said common or very common. And the men agreed. More than half of men said, yeah, common or very common. So you could, because of this very high correlation between sexual harassment and sexual assault, you can use sexual harassment as an indicator of risk or disorder or problems in a way that would be very hard to do with sexual assault, and so you could target things better, knowing this tight correlation between the two.
So if I can just follow up and prod you to get you to say a little bit more, could you say a little bit more about what predicts risk? You already mentioned a couple of factors like age, you mentioned a specific environment like a ship, but if you could talk a little bit about risk in relation to the characteristics of victims and perpetrators, and then also say a little bit more about the men who appeared in this collection of data.
Yeah, so a lot of the risks are the same for men and women, and they're not that interesting in terms of like the demographics of the people. I mean, they're what you'd expect. Gender is one of the biggest risk factors, and actually in the 2016 report that the Department of Defense produced, it's quite clear that LGBT status is a super high risk factor. We didn't get to measure that. We weren't allowed to measure it when we did it in 2014. But the 2016 study did, and it's a risk factor. The marital status, education level, their rank, of course, it's correlated with age. These are things that are true about, that are risk factors for victims, men and women. For perpetration, what we know, we don't know a whole lot about perpetrators. It's much harder to do a survey of perpetrators. Hasn't really been done across the military. Not sure what you get out of that. But what the victims tell us is that the perpetrators are almost always men. That's the perpetrators against men and women, or groups of men, and that they are almost always members of the military. We're not, the sexual assaults that are getting reported on the surveys are not assaults by family members or exes. They're not assaults by strangers. More than 80% are other members of the military the person knew. And if looking at it another way, you can pretty much conclude that more than 90% are military related in one way or another. Where there's some big differences between men and women is around the circumstances of the assault. So for instance, men are much more likely to be assaulted by a group of men during work hours, no alcohol involved. I think the number is 4 or 6 times more likely to describe the assault as an act of hazing, not describe it as a sexual act, even though it meets the legal definition of a sexual assault. So those are some of what's true about the demographics of victims and what we know about perpetrators. In some ways, the most interesting questions, and the ones that another set of interesting questions is, what is it about the environment that might be facilitating this? The climate, or the command climate, or organizational features like the percentage of men in your unit, or things like that. And that's something we've been looking at, and we haven't made super great progress on. We have identified some things like percentage of men in your unit is a risk factor for sexual assault, sexual harassment. But I think there's a lot more work to be done on those things, because that's what the military could really have some control of. You can't really control the age of your service members that easily, but you could control environmental factors.
Thank you. We'll turn now to Emily. Emily, you recently signed on to be a consultant to the Navy Sexual Assault Prevention and Response Office for next year, 2020, is that right? What are you going to be doing in that role, and how might it help the Navy or the Department of Defense address sexual assault?
Sure, yeah, so I recently just started that contract, and I think the main thing that I'm doing is I am bringing my public health brain to SAPRO, Sexual Assault Prevention Response, and the thinking that people are doing at DoD around sexual assault. There are a couple of things that public health does well, if people are not as familiar with public health. So the way that public health approaches the topic of any kind of violence issue is just like you would any other epidemic. So thinking about its, how do we respond to it, not just after the fact. So somebody's been sexually assaulted, now what do we do with either the survivor or the perpetrator? That's what we would call maybe tertiary prevention. But public health also thinks about things in terms of, well, let's look at the group of people that we think are at risk for either experiencing sexual assault or perpetrating sexual assault, and looking at that layer of people, what could we be doing there? What could we be doing for them? And then going even further out, public health is good about thinking about primary prevention, which is for people who haven't even experienced sexual assault at all yet, what do we know about this issue that would enable us to put something in place to prevent it from ever happening in the first place? So that's very classic primary, secondary, tertiary prevention way of thinking. And increasingly, I think within the military, there is this recognition that it pays to think about all three types of strategies or approaches to preventing sexual assault. And then the other thing that public health, I think, does well, and we've been talking about already a little bit, is not just thinking about individuals and what puts them at risk, either for becoming victimized or being a perpetrator, but thinking about like the bigger picture. What are factors that are in between people who are peers or family members, and then thinking a little wider, what about communities might be putting people at risk? What about the workplace setting? What about the society or the culture that we're all a part of, if we're part of the military or whatever setting we're in? So by using those kinds of public health ways of thinking or tools, since that's what my training is in, I'm able to bring in that kind of angle to some of the work that people are trying to think of doing. And very more concretely or more specifically, what my role is to help people think about evaluation. So I'm personally fascinated by, there's lots of good ideas about what we could do and what we might do that is the right way to respond to people who've been sexually assaulted or perpetrators, or even right things to do in terms of prevention. There's been 54 different prevention strategies that have been put into place since 2012 in SAPRO. In the military. And the question is, which ones are working? And why are they working, if they are working? Or what pieces of the ones that are not working? And are there tweaks that we can do that are cost efficient, that will help those things work better? So answering those kinds of questions is really what motivates me. And some of the things that we've already done is have a meeting, for example, with some of the people who are responsible for implementing sexual assault prevention initiatives across the military, and trying to teach them a little bit about these evaluation approaches. Like, how do you answer those kinds of research questions? How do you get evaluation work done? So over the next year, I'm looking forward to doing more of that, and with my colleague, Dr. Sharon Potter, who's been hired as my partner to do that work together with me. I think that we're going to be helping Navy and DoD SAPRO more generally come up with a framework that can be handed over to people about how can we effectively evaluate the sexual assault prevention work that we're doing.
Okay, and I want to follow up. There will be, I think, several points in this conversation where we'll want to make some generalizations and extrapolations, if possible, about other environments besides the military. And so I want to just follow up with you on this right now, because you've also worked on dating violence and sexual assault prevention planning for colleges and universities, as well as the military. And as you know, Penn's, we're all ears. It's of a particular interest to us at Penn because our campus sexual assault rates remain nearly unchanged despite policy changes. How do military and university settings compare, and how would you, in particular, adjust your policy recommendations for universities to account for the differences?
Yeah, this is a really interesting thing to think about, I think. So the way that I got to do some research with the Navy was having first done that exact same type of research, but with campus fraternities and sororities in a college setting. So I had the experience of first testing an intervention with this college population and then testing the same intervention with the military population. So I did get a little bit of insight, I think, about what's similar and what's different. One thing worth mentioning, though, is that the military is now holding national and regional conversations, they're calling them, about sexual assault prevention. So there was one last April at the Naval Academy. There was a regional conversation just a month ago in New York City, and I know that they're going to continue to have these. These conversations are to bring together people who work in the military and people who work at colleges and universities for this very reason, to talk about what they do have in common and to learn from each other to push the field forward in sexual assault prevention. So that's happening, and clearly people are aware of the many commonalities. So there's a lot of young people. We were saying young people are age group that's high risk, and so there's, I think, the acknowledgement of that. It is different because I think it's roughly half or a little over half of active military personnel are married, which is not necessarily true of college students, and so that can create a different dynamic. There are aspects of military culture that are potentially dissimilar than college campuses, or sort of, the tools that the institution has to use in order to promote certain social norms, or if somebody's done something wrong, if they've perpetrated sexual assault or sexual harassment, what is going to happen to them, that can vary. How you access helping resources can be different and can have different kinds of consequences depending who you are and where you are. There's a number of things that make it different enough that although some of the root cause issues are the same, how we solve them might be different. And I guess the way that this plays out most directly so far that I've seen is that at the college level right now, the conversation in terms of sexual harassment prevention, sexual assault prevention, is I think starting to go to that larger outer layer of the social ecology type approach, where people are thinking about equity, they're thinking about gender equity in general, and how do we change social norms in general on this campus in order to promote the kind of behaviors that we'd like to see. And in the military, because there's such an acute problem and people are really focusing on solving sexual assault and harassment, I think the approach is to work a little bit more fine-grained right down at that level of the incident, instead of the outer layers so far from what I can see.
Thank you. I'm going to turn next to Melissa. Melissa, you've worked, your work is focused on women veterans, that is women after they leave military service, and you have worked on both sexual assault and intimate partner violence. I want to just start with the question of intimate partner violence. You found that women who served in the military have higher rates of lifetime intimate partner violence than women who haven't. Are there data indicating what the relationship might be between a woman's experience of sexual harassment and or sexual assault in the military and this higher than average lifetime risk?
Yeah, thank you. So we've been looking at experiences of women who have served in the military at some point in their lives, most of whom are now veteran status, that is, they've separated from their active duty military service. And we look at intimate partner violence as defined as forms of violence or abuse that is perpetrated by a current or former intimate partner, and that can be sexual violence. And so some of the sexual violence that women experience, women who are veterans or during their military service, some of that is intimate partner violence if it's perpetrated by a current or former intimate partner. And then we also talk about non-partner sexual violence. So we look at women's experiences of both intimate partner violence, some of which is sexual in nature, and non-partner sexual violence that is not perpetrated by an intimate partner. We looked at lifetime experiences of intimate partner violence in multiple forms among women who've served in the military, and we asked about experiences before, during, and after military service. So we found overall higher rates compared to women who had not served in the military, but looking at the time frames I think is interesting. We see that there are some women who experience forms of intimate partner violence before they enter military service, and that's true for non-partner sexual violence as well. And that speaks to some of the theories around women's entering military service to escape adversity. So sometimes the military can serve as an escape from an adverse environment, maybe where they're experiencing various forms of violence. Many of the women who enter the military enter quite young, at the ages of 17 or 18, so they may not have experienced any intimate partner relationships at all. But we've also seen higher rates of other, what we call adverse childhood experiences among women who serve in the military. But some of the women who served in the military didn't experience intimate partner violence or sexual violence before entering their military service. We saw a number of women who experienced partner violence and non-partner sexual violence during their military service. I think the intimate partner piece there is interesting because we talk a lot about the non-partner sexual violence that women experience during their military service, but they may also be exposed to violence from an intimate partner during their military service. Sometimes that intimate partner is also serving in the military and sometimes not. There are different complications and implications when that partner is serving in the military. We also see rates of intimate partner and sexual violence following women's military service. So some of the implications from this work is that military service does not protect a woman from experience of intimate partner violence. And it's important to think about the fact that, you know, women who serve in the military may gain access to a lot of resources and a lot of internal and external strengths, but they may also experience the same kinds of violence and adversity that women who aren't serving in the military experience. We do a lot of qualitative, in-depth interviews with women who've served in the military. And one of the things that has come out from those interviews is about that idea that others may think of me as someone who's not vulnerable to experiencing violence. I spoke to a woman who served in the Marine Corps, and she said, you know, people said to me, "You've served in the Marine Corps. You can handle anything. You can, you know, handle anything on your own. You don't need help. You're not vulnerable to anything." And it was really important for her to articulate that, you know, just because I've served in the Marine Corps doesn't mean that I haven't been victimized and violated, and sometimes by a person who may be my current or former intimate partner. Doesn't mean that I'm not deserving of help or support or additional resources to address these experiences.
So just following up on that, what then, I mean, you are describing an expectation about women who've served in the military as not being vulnerable. What does the military experience actually do to a woman's own resources going forward, perhaps later in military service or after military service, to be able to cope with either intimate partner violence or other kinds?
So there's benefits and drawbacks, right? So through military service, women can gain training, employment, financial resources. As veterans, women can gain access to veterans benefits. At the VA, we have an intimate partner violence assistance program. We have social workers. We have support services. We have connections to community resources. There are a lot of resources that can be available to people who have served in the military. There's also some limitations and some challenges, and people on the panel already have alluded to the fact that, you know, the military serves as kind of a total institution. As Dr. Sorenson was mentioning, you know, you're required to report up to your chain of command. So unlike being on a college campus where you may have the resources available through the college or the university, but you can also go outside, you can report to the local police or your local community services. When you're serving in the military, you're required to report up through the military services and the military chain of command. The military can oversee your health care, can oversee your legal experiences, and so you're restricted from accessing some of those civilian resources by being required to go through some of the military resources. In our work, we heard from many women who talked about what we think of as premature separation from military service. That is, leaving the military before they wanted to or had originally planned to, as the result of, in many cases, of gender-based violence, of sexual violence or non-partner sexual violence or intimate partner violence. And when you leave early, there can be some implications there too, right? So if you serve out a full career in the military and you have access to retirement benefits, but if you leave early, you may forfeit access to those benefits. And so many of the benefits and opportunities that come through military service can also be cut off from you if you are leaving prematurely or not having access to those resources as a result of that.
Thank you, and I want to turn now to Lieutenant Goldstein. And I wonder if you could just start by just talking a little bit about what it means, what the implications are of this relatively late receipt of full veteran status by women who've served in the military. Only in the 1980s did women achieve that right, and it is a right because it includes benefits to full veteran status. So why was it so late in arriving, and what have been the implications of that change?
Yes, thank you. So veteran status and serving in the military is power. It's a very powerful identity to have. And by erasing the very long service of women in the military, it is effectively erasing that power. So it was mentioned in the introduction that women have served in the military in combat roles since the Revolution, but women have also served in roles that are now militarized. So logistics, one of the very first special operations operators was Harriet Tubman. These are roles that were not recognized as military at the time, but absolutely are now. And what's more is that it's not just that service happened, that service was recognized by Congress. 2 women received disability pensions for their service in the Revolution. At least 2 women received disability pensions for their service in the Civil War. The reason we say at least is because many of these women served disguised as men, and we know about 500 women who served during the Civil War disguised as men. That number is an undercount, and the reason we know those is those are the women who got caught. We don't know about the women who went on with their lives and may have continued to draw a pension under the name that they served under. So why the 1980s? Well, this is after the all-volunteer force went into effect in 1974. More women served in World War II than are currently serving in the U.S. military now. Over 400,000 women served as uniformed military during World War II. And so it was also recognized, so the 1980s, there were categories of women who had served who were recognized as veterans over that period of time. But in the late 70s and early 80s was when they finally did the phase in of, okay, you did this during World War I, you did this during World War II, you did this during this named operation that happened in between. That was when that happened. So it was absolutely necessary to recognize the service of those women in order to increase the number of women serving in the all-volunteer force. Because at that point, and by the way, every single woman who has ever served in the U.S. military has been a volunteer. So it was, which is also part of the connection with power. So it was absolutely critical to have that there. Now, in the 1980s, there also weren't bathrooms for female patients at VA. The Women Veteran Program Manager position, which now is at every single VA medical center, didn't exist until 2011. And to this day, at least 1 in 4 women who use VA as a patient is sexually harassed. So we still have a long way to go when it comes to that recognition of women as being deserving of the benefits that they have earned through their service. And I find it very important to put in my bio that I was a special operations troop commander, because I'm definitely not what you think of when you see that. When you think combat veteran, you probably think of one of two things. You think of an old white man wearing a VFW hat saluting at a flag, because that's probably what comes up when you Google a picture of a veteran. Or you think of a white man who's about my age, who has a full beard and is wearing a t-shirt that says United States Marine Corps. So it's very, very important to also talk about these identities and that we exist and that we come from all walks of life. The women veteran population today is the most, not only the fastest growing, but also the most diverse subset. It's about 30% minority, 10% LGBTQ, so it's also an incredibly diverse population and really always has been.
So thank you for that. And if you could tell us a little bit about this role that you've recently taken on. In May, the House Committee on Veterans Affairs launched a new bipartisan Women Veterans Task Force, and you're the lead staffer for it. If you could tell us a bit about the task force, about what you do for it, about what it's supposed to be doing, and some of its kind of targets, its focus, and yeah, why don't we start with that?
Absolutely. So the Women Veterans Task Force is part of Chairman Takano's VA 2030 initiative, which is about the VA reforming and developing to be prepared for the changing demographics within the veteran community and within the veteran population so that we are prepared. And a big part of that is serving women veterans. So the Women Veterans Task Force is chaired by Congresswoman Julia Brownlee from California, and she has been a champion for women veterans for a long time. This was a big priority for her in this Congress. Like I mentioned, women have served this country since there has been a United States, only got veteran status fully about 40 years ago, and continue to face tremendous inequities in their access to care and benefits and other federal resources. Some of these gaps are very easy to see. It's very easy to see personnel shortfalls. My colleague and I, who's here with me today, we visited the Philadelphia VA, and they said, oh yeah, we're great on staff, but we have already outgrown our space. And we hear that consistently around the country. Usually it's both space and staff. So that's a very easy deficiency to see. That it's like, okay, that's something that we could say, okay, let's look at how we can plus up your staff, how we can appropriate money to improve the facilities. But then some of those cultural issues, well, how do you address the prevalence of sexual harassment? VA is the absolute best service provider for addressing military sexual trauma in the country. And yet it is also a location where that can be triggering to that same trauma. How do you address that? How do you address something that we could address that legislatively, and we have addressed it legislatively, but it is largely a cultural issue? How do you address the fact that many women don't consider themselves veterans, and if they do, they say, well, someone else is more deserving of those benefits? There's a huge gap in the women veteran population between how they consider themselves to be veterans. So women who serve, so Gulf War era veterans, so post 9/11 and women who served during Gulf War do consider themselves veterans. They may not necessarily participate in the veteran community, but they do have a strong veteran identity. And if you ask them if they're a veteran, they will say yes. Women who served before that, the women who were really breaking down barriers, who served who served in Vietnam, who served at the advent of the all-volunteer force, those women who integrated the service academies, those women are less likely to consider themselves veterans because they didn't necessarily serve in combat, and because there are also cultural nuances to serving in the military that tells you every single day that your service matters less than a man's. And so that is part of the reason why women veterans are also less likely to access the benefits that they have earned. 75% of women veterans do not use VA. They are not enrolled in VA. They have no interaction with VA whatsoever. Women veterans are also less likely to apply for disability compensation, but also when they do apply, more likely to earn it. So these are all some of the issues that we're trying to address, and a lot of it is through outreach. A lot of it is through the 79 members of Congress who are working with the task force in being actively engaged in their communities to also ensure that women veterans are visible, because we're very, very visible, a very visible minority when we're in. It's very easy to pick out the 5'0", 5'0" sailor in a sea of 6 feet tall men. But when we leave, we become invisible. And so the task force is also focused on resolving that.
Okay. So this next question, I had originally thought about it in the context of your work, Lieutenant Goldstein, but I want to actually use this to kind of open the discussion among the panelists. I understand that you believe that service members and veterans from all backgrounds, not just admirals and generals, should be part of policymaking and research going forward about how to address this. And we've had the figure, from Emily, about 54 different preventive strategies in place. So I guess this could yield even more preventive strategies, but also perhaps some solutions. What I want us to think about, I guess, and just hear from all of you, what's to be gained from the more inclusive approach? I mean, some of that might seem rather obvious, but I also want us to think about, is there a downside to a more inclusive approach if it isn't kind of owned by, top military hierarchy? Is there perhaps a risk that it doesn't actually create culture change all the way up the hierarchy? And then second part of the question, and this is really for everyone to chime in, what are some of the takeaways for thinking about other environments too? I mean, if a kind of a full buy-in from all members of a diverse community into the kind of policy and culture change is necessary to really make the change, is this something that college campuses and universities, other workplaces should also be thinking about? So I want to, this question had your name on it first, so you can feel free to start, but I do want to open it up to everyone.
So to answer the very beginning of the question bluntly is because the admirals and generals don't actually know what's going on. We had a roundtable discussion on military sexual trauma a couple of weeks ago, and one of the participants raised that, okay, I'm an elder millennial, and I only recently found out what TikTok is, and that it is very popular with people who are only 10 years younger than me. So imagine someone who's a 4-star general or admiral who's 30 years older than me. They have no idea what harassment and abuse looks like amongst 18 to 24-year-olds. There are terms that are being used that they don't understand. There are technological means of abuse that they don't understand, that it is absolutely critical to have the voices of the people who know what's going on because it is happening to them or they are witnessing it to be at the table. And so certainly with the task force, we've taken an inclusive approach, or I hope we have. We're certainly trying to, in not just bringing in the veteran service organizations that everybody already recognizes, the American Legion, the Veterans of Foreign Wars, who absolutely are important partners in this, but community-based organizations and enlisted service members and recently separated personnel, people who have bad paper discharges, who are living these experiences right now every single day.
So, and excuse me, because I do want the rest of you to chime, but so putting the question somewhat different, can the top of the hierarchy in a hierarchical organization learn from their subordinates?
If they want to.
But, yeah, okay, so that kind of answers the question a little bit, yeah. Okay, so I'm happy to, if anybody else wants to chime in on this question.
Sure, yeah, Andrea, I think that these are really important points to also recognize that for many people who serve in the military, there are barriers to advancing to those higher levels that are related to some of these issues. And so it is important to hear not just the generational differences for sure, the developmental differences with age groups, but also from people who face barriers to getting to those higher levels, maybe because they experienced this harassment or assault or abuse, and hearing from the voices of the people who maybe aren't able to disclose and report. When we rely on the data of what's reported, officially reported in survey research, and then when we talk to people one-on-one, we get very different pictures because you uncover some of the things that people face barriers to reporting.
Okay, so another question to throw out to everyone. The impact of #MeToo on what's going on now in thinking about the military as a particular kind of workplace where sexual assault and sexual harassment in relatively equal proportions, according to your research, are endemic. Anyone want to talk a little bit about whether there's been some influence from #MeToo and what that might have been?
So I'm not in the military right now, and so I don't know what day-to-day life is like. But I do know that somewhat before #MeToo, the military had a big crisis around sexual assault, sexual harassment. The 2012 survey numbers suggested that 26,000 people had been sexually assaulted in the military, and it caused a crisis on Capitol Hill. And it got Kirsten Gillibrand and McCaskill and others very focused on this issue and coming up with solutions that scared people. And so I think that in some ways, I'd make the case that the military had a kind of #MeToo experience a little bit before the rest of the population, and got very, very, very focused on sexual assault. You mentioned like 40 or 50 policies or interventions that are taking place. Is that just the military? Is that just the Navy? Because
No, that's SAPRO.
SAPRO wide?
Yep.
I thought it was more than that, but over the years it's been more than that. Since around 2012, there's been just a huge number of new policies, new programs, victim advocates, attempts to hear from victims themselves, and policy-making processes, trying to be inclusive. I think that they're taken really seriously, and I think that they haven't solved the problem. There's a lot of room to improve. But I don't know another organization that has devoted as much resources to response and prevention.
I would just chime in because I'm still halfway in the Navy. Because I was in when that change, when all those changes started to happen, and now still being in the reserves, I would absolutely concur that Me Too moment was when the Invisible War came out and when all of that survey data came out, where we typically only have to do mandatory training on sexual assault once per year, and that year I think we did 3 or 4 trainings, almost to the point that some people started joking about it, which you don't want to happen, but people joke about things that make them incredibly uncomfortable. And so when Me Too happened in broader society, within the military community, you'd be like, okay, well, we've had this, we've already been part of this conversation.
I was just going to add, this is kind of a nerdy take on this question, and it's from the data and numbers perspective. That one of the things that Me Too has done is it's made it even more confusing to understand how to interpret data. So when we are trying to track things over time and figure out, is sexual assault, for example, a problem that's getting worse or getting better? And you want to look at, well, how many people are reporting it? That would be a natural way to try to count whether it's getting worse or getting better. But then you see an uptick in the numbers, and this is one of the things, it's not just the military, that colleges and universities or other places are dealing with as well. When we see an uptick, is that something that we should get excited about? Because that means that people are now more comfortable reporting it, whether it's that they made a formal report to an entity, or they're more comfortable even just reporting it on a survey, because they've articulated it to themselves differently, perhaps because of the support of a Me Too movement. Or should we feel disappointed because, oh, our numbers are really up? that's more people who are telling us that they've experienced sexual assault. So this isn't quite what the question was driving at or wondering, but it is one of the things from the research side of things that we do have to wrestle with, is getting at the truth and understanding what's happening in a weird way can be complicated because of these movements, because you don't know then how to quite interpret the upticks that you do see. That may be counterintuitive. Like if the Me Too movement is helping people, shouldn't we see numbers plummeting? Not necessarily what we're seeing.
Melissa, did you have anything you wanted to add at this point?
What I'm observing is that we're seeing more attention generally to sexual violence and to harassment. And so VA has now an End Harassment campaign, really focused on experiences of sexual harassment that are happening on VA campuses. And so I think the broader Me Too movement allows us more opportunity to engage in conversations outside of the military environment, outside of the VA environment. And I'd agree, I think that we've been seeing these conversations really going on with the military population earlier than this larger kind of societal Me Too movement. I think maybe one of the helpful pieces of that is that we recognize that this isn't just a problem that's happening in the military. And I think in some ways the military has gotten sort of stigmatized, that this is a place where people are getting sexually assaulted. And maybe the broader Me Too movement is helping us recognize that it's not just in the military.
Well, that's just exactly where I wanted to go next, actually. I want to, again, hearing from everybody, so what is the relationship between the military and all the rest? Andrew has reminded us that in many ways the response of the military to a crisis around sexual assault and sexual harassment precedes the Me Too movement. So is it right to think about military workplaces as kind of caricatures or distillations, intense zones of what's going on elsewhere? Is it such a different kind of environment, a different kind of hierarchical order that in fact that's a wrong way to think about it? I mean, how should we understand it? And this, of course, is going to the other question about what we can take from what you all are telling us about the military efforts at prevention, efforts to kind of create a more equitable, safer environment, and what we might take away from that for the rest of society. So what's the relationship between the military and everything else out there?
I would just want to highlight the one key fundamental difference. I'll talk about two things, but they're pretty heavily connected. One is that you are trapped in your unit.
You're trapped in your
You're
unit.
trapped in your unit because this is largely happening between service members. And connected to that you're not just trapped in your unit, but the person who is perpetrating the assault is someone who is supposed to guard your life. And that is a fundamental betrayal and a fundamental difference that you do not find anywhere except the military and maybe law enforcement.
And excuse me for just interrupting, but intimate partner violence has some resonance with that, right?
It absolutely does. And then add on, Melissa mentioned that particularly amongst active duty service members, you have a lot of women who are in relationships with other members of the military.
Yeah, I guess I was thinking of intimate partner violence in a non-military
Yes.
context,
Yes.
where there's
Yes, it
some
is absolutely
element
someone
of not
who's-
being able to walk away, there's some element of, military relationships are also intimate, if not always in exactly the same way that they are in non-military contexts, right? Somebody's guarding your life, that's an intimate relationship, I would argue.
Yes, it is.
Okay.
So I would say, though, that the military is sort of this third party to that intimate relationship, right? So you can have those same power dynamics that can happen in any intimate partner relationship where there's violence or abuse. But you have this third party. So, one woman veteran I spoke to said that the person who was abusing her was her intimate partner, who happened to be lower ranking than her. And for a variety of reasons, she didn't report to her chain of command that this abuse was happening. When they found out that she was experiencing this abuse, she says they told her, we're not promoting you because he's lower ranking than you, and therefore you should have reported him because you're higher ranking and he's not supposed to disrespect you. And so she was punished for not reporting, and a lot of people who are experiencing abuse don't report for reasons that are related to their safety and survival, that it's safer to not report than to report. And so there was this element of the rank that came in and the reporting that was within the military structure. We also hear things about the military kind of owning your body and your body as a tool. And so if your body gets injured and you can no longer perform your duty, that impacts potentially your work. People talk about, if I show up with a black eye, even though that might not impact my performance, I'm not allowed to have that bruise from an intimate partner or from a sexual assault. And so there are ways in which it seems that the military employment environment functions differently from other employment environments, where you can also, leave this job and go to another job where you might get the same benefits. There's no alternative. There's the military or not the military, and those benefits don't get replicated in some other retail setting or university setting like you can move through more easily in the civilian world.
Emily or Andrew, do you want to weigh in on this?
I guess one of the things I'm thinking about is a story that a sailor told me on one of the ships that I was on recently this past year about having a problem and wanting to get mental health help, and feeling that that wasn't an option for him because asking to get that mental health service meant that there would be repercussions, possibly not promoted or possibly facing other repercussions. And the stigma of having asked for mental health assistance would be so great that basically was really inhibiting for him. So sort of wondering what roots there may be around that, or how, when people recognize that they are in need of help, that is one of the things that's different. So we're talking about it as a workplace, and this may be very specific to living on a ship or being out at sea or something like that, that you are also living there. And so there's many, if you work in a workplace and you go there 9 to 5, you may be able to seek mental health services, and your employer may or may not know, or only a limited number of people. In this setting, there's enough differences about the way that the day-to-day works and also what you can have access to, that as we try to solve these problems of intimate partner violence or sexual assault, ultimately grappling with some of those and how to make the helping services more accessible and less stigmatized may be useful.
And that seems to connect back a little bit to some of your work looking at different site-specific locations in the military as different workplaces with different kinds of risk.
Yeah. No, I agree with everything everyone's been saying. The other thing that really strikes me about the military is, unlike you and me, if we're being sexually harassed, if we're in the military, we can't sue our employer, and being able to sue your employer has really gotten employers activated, and I think that there's a way. The recommendation I always make when people will listen to me is that the military could do a lot more to focus on sexual harassment. It's much more common. Right now, sexual harassment training in most services is optional at the commander's discretion, and yet it looks like it's very, very closely tied to other kinds of problem behavior, including sexual assault. The military is all about good order and discipline. That's what they're trying to train, and they're very good at training. But this is obviously a breakdown in good order and discipline, and it's a conspicuous one. It's something that could be more attention could be focused on that.
So with Andrew as the kind of lead off in that line, which was going to be my next question, and what are your specific recommendations? If we could just go down the line and each of you, think, your wish list for what you would like to see happen that you think actually could result in culture change, in real reduction in some of these rates, in improvement of safety of the conditions for women in the military.
Yeah, I like that idea of attention to sexual harassment. I think as part of that, really getting into what is sexual harassment, right? Making sure that we all understand what is this, what does it look like, and having that accountability when little things come up, right? We sometimes talk about microaggressions or, don't do that like a girl, right? Like, what are the reverberations of that? And getting people to understand when you take a step back, like, what are the cultural elements that perpetuate this acceptance of gender-based violence that can then lead into tolerance of sexual assault and harassment.
I guess I feel very passionate about my wish list, so thank you for this question. And I should say first that it looks to me like Rear Admiral Burkhardt and DoD SAPRO already is well on the way to achieving this wish list. But I would say investing in evaluation and believing that evidence-based practices are the ones to use. And so basically you don't just want to throw spaghetti at the wall and see what works. If you invest in beforehand doing formative research to figure out what kinds of sexual assault prevention strategies are going to work for people, what's going to feel culturally relevant, what's a good fit, you can have better success. That it is possible, we know from other topics and from other settings, to do sexual assault prevention programming and strategies that work. To do that, though, you need to do formative evaluation, you need to do process evaluation, you need to do outcome evaluation, and when you know what works, you need to stick with using the things that are evidence-based. So, as I said, I'm feeling very passionate about evaluation, so that would be my list.
So I'm going to tell a very quick story, which is that in the 1970s, the U.S. military had a very big drug problem. Today, the military is virtually drug-free. I would like to see the appointed civilian leadership and 4-star level commanders treat eradicating sexual violence in the military with the same seriousness that going drug-free was. It was seen as something that was impossible, and yet evidence-based practice helped eliminate it. And today, service members are relatively drug-free, not because they're afraid they're going to get drug tested, but because it is simply not part of the culture. And I would also, with that level of seriousness that I would like to see it treated, right now, addressing sexual violence in the military is seen as a distraction from the mission, but this is about your people, and the people are the mission, and I would like to see that as treated with the same level of seriousness that developing, say, a space force would be.
Now, do we have some questions on note cards from the audience? Oh, okay. I guess I'll just go for it. All right, we'll go for this one first. We're collecting a few more. You've mentioned some potential connections between the military and college campuses. Some of my campus sexual and violence research revealed very high incidences of sexual violence within ROTC members, particularly women. These women mentioned many barriers to reporting and seeking help for these experiences. Do any of you have any experience working with ROTC members or insight into this issue? No one. Okay, well, does anybody want to venture something to this person who's written this question?
I'll throw out one thing that's tangentially related, which is that we have looked at Guard and Reserve members, which are an interesting population because most of them serve less than 40 days a year, and so are not necessarily in a military environment most of the time. There are a subset that serve more than that, more than 40 days a year, or all year if they're on active status. And what we find is that the Guard and Reserve members we've studied have lower risk of sexual assault than active component members. But that the service members, the Guard and Reserve who serve more than just the minimum annual service time have significantly higher risk. And that the assaults that they report are military-related assaults. So there does seem to be a connection with something about the military environment. And it may be unique. It may be unique to Guard and Reserve members. I think that there's something, you go away from your family, you train on however many weekends a month, and going away from the family and having this sort of disruptive thing, maybe that involves maybe that's the risky thing. That's not the military per se. So we don't know what it is, but we do see that there is this connection between military service and higher risk in some populations.
Okay, so the next question, did I cut anybody off on that, or is that, okay. The next question, this program is titled Violence Against Women in the Military, but many men are also victims of sexual violence and they're even more reticent to report it. Can you comment on ways, if any, the issue of sexual violence against men is being handled and addressed? And this certainly came up in some of your research, and I guess I would follow up on that. And is hazing, does it all fall under hazing, and should it fall under hazing? And if you could tack that onto this question.
Yeah,
too.
no, about 30% of the men who report on surveys that they were sexually assaulted consider that event to be hazing. 70% no. But in terms of what resources are available to victims, I think that they're very similar. The services that are available for men and women are I think, as far as I know, identical. But I'm probably not sufficiently expert to answer that.
Yes, they are identical, but some of the resources that actually might be better for serving male service members are on the veteran side, and active duty service members and many members of Reserve and Guard can use vet centers. And what's very interesting is the Defense Advisory Committee on Women in the Service did 54 focus groups of both men and women and found out that 0 of them knew that they could use vet centers. So perhaps the best resource for male survivors of sexual assault in the military is not one they know about.
I think one thing that, just to tag on to that, I suspect that a lot of men who are sexually assaulted don't consider that they experienced was a sexual assault, and it would not occur to them to report that they were sexually assaulted. It would not occur to them to go seek the kind of medical and advocacy services that are available to sexual assault victims. Because the guys were playing this game and joking around in the shower, so there may be a mindset too that makes them not as likely.
I would add to that there is certainly, the majority of the people who've served in the military who experience assault are men, because the majority of the people in the military are men. The rates, the proportions are different by gender. There is also the stigma against men reporting experiences of sexual victimization in particular. For some men, there are concerns around ideas around sexuality, especially in the wake of Don't Ask, Don't Tell and prohibitions against people who identify as gay or lesbian serving in the military, because most of the sexual assaults are perpetrated by men, even when the victims are men, and so there can be concerns there. Andrea made an important point about sort of the visibility of women service members and women veterans. And so one of the things that we see is that an important information source for people who've served in the military, for veterans, is other veterans and other military service members. And for women, women are a minority in service, and women veterans are a minority in the civilian community, such that you may have no other women veterans in your town or in your community that you know of. It may be harder to connect with and find other women veterans. There are lots of groups of male veterans, and some of that peer support can be easier for men and harder for women who are looking for other women veterans with some of that shared experience.
Okay, a couple questions that have to do with what happens to perpetrators and what happens to women who report. And so this person points out that there were no prosecutions of the tailhook perpetrators. So this is really about asking about that side of it. You know, roughly how many reports are there? What happens to the perpetrators? How do those end up? What are the outcomes? And in particular, what happens to the women who report? Are there retaliations? You know, do they feel that justice is served, or are they among the people who have the early separation from the military?
So both men and women experience, it's higher for men and women, and I'm sorry, off the top of my head, I don't know the exact statistic. But I believe it's 58% of women and 68% of men. It is over 50% for both experience retaliation when they report sexual assault. What typically happens is that the victim is punished and the perpetrator is promoted. I reported sexual harassment in 2014. At that point, I don't know if I would have reported that. It was my boss who was harassing me. I don't know if I would have reported that if I didn't know that I was planning to leave active duty. And so at that point, I did not really care about my career. I was retaliated against. He was fired from the command, but then sent to another career-enhancing position. He was given at least adverse paper, but is still serving in the U.S. Navy Reserve. And things eventually worked out for me. I consider myself one of the lucky people, but I was retaliated against and his career was fine. That holds up.
And it can really vary, right? Like if you have to go to your command, depends on what your command's perspective is and what their relationship is to that perpetrator. And it can be very idiosyncratic. Despite there being very specific rules at every level, we're still dealing on an individual level, and people have really varied experiences.
So this is probably going to be our last question, because I think we're pretty close to the end of our time here. So, and this is a fragment of somebody's question, but how much of this has to do with a kind of maybe hidden or not so hidden resistance by males in the military, by men in the military, to having women in the military or in combat positions? I mean, how much of this is just still part of the culture because the military has not accepted, I mean, down to its kind of essential elements? I mean, if the personnel are the mission, to what degree then has the mission, at least the male membership of that mission, not accepted women? I mean, is this part of it?
So, provide my opinion, which is that I think it's only very clearly tied up in one service, and that's the Marine Corps. I think the acceptance of women in this issue are completely separate in the Navy. But the Marine Corps in particular has the lowest percentage of women, the highest rate of sexual assaults. To Andrew's point, there is absolutely sexual assault taking place in showers in boot camp. I have had many male Marines tell me that the reason they can't gender integrate boot camp is because that happens without realizing that they are describing to me a sexual assault that they endured in basic training. I think in particular pockets of the other services, it's connected. But in the Air Force and the Navy, the core competencies, those core combat competencies, have been integrated for 25 years, so it's connected to a different issue.
And I guess I would just argue, to back that up from a research perspective, that because the prevalence rate is not all that different in colleges and universities, that it can't, even if a percentage of it is due to that, it may not be explanatory for the lion's share of what we see going on.
Anybody else? Okay, well, we'll let that be the last word. I just want to thank you all for a really stimulating panel, and thank you so much for sharing your work with us.
What a wonderful panel. I just feel very stimulated and like I've got lots to think about. And one of the things I'll do too is eat a little bit on that. So please join us upstairs for a nice reception. If you go up the stairs to the right, and to the left, you'll follow the smell of the food and all of the law students hovering. So please feel free to join that before they take all of it. Thank you for joining us.